So we are thrilled to welcome Dr. Watkins today. He is currently serving as the Health Equity Advisor at the New York Department of Health and Mental Hygiene. He's previously held roles there as the Senior Clinical Advisor and the Physician in Charge. He's also the founder of the People's Project, which is a multimedia art installation promoting community building and healing from the effects of COVID and ongoing institutional marginalization. And he is deeply committed to health justice. So we are thrilled to have him here today to talk to us about monkeypox, also known as MPV.
Again, my name is Julian. I'm an internal medicine doctor by training. I also do sexual health and emergent infectious diseases with the health department. Spent the last 2 years working in the city for the COVID response, still doing that ongoing, and also over the last few months with the MPV response. So, we continue to move forward with the primary goal of health equity to make sure that we can get the whole city access to some, really important public health information, as well as a few interventions that are really helpful. And I'll talk a little bit about what's going on in the city and some things that we can all do to help keep ourselves and our communities safe. All right, so what is monkeypox or MPV? So MPV is a contagious disease caused by a virus that was named monkeypox. Monkeypox is part of a larger family of viruses. It's not actually related to chickenpox, but it is related to something called smallpox and a few other viruses that bear the name pox. Monkeypox has been identified in humans since the 70s. It's been endemic or been found locally in certain parts of Western Africa, and over the last few months we've seen it spread beyond where it has been found for the last few decades to other parts of the world. So right now there's a global epidemic, or there's a global spread of this virus MPV, and it's been found in over 95 countries where it hasn't been previously seen or isn't regularly found, and there's been over 57,000 cases globally. It's something that has been declared an emergency by the World Health Organization, by the United States of America, by New York State, and by New York City. And we'll talk about why it's important, especially for all of us in the 5 boroughs in Jersey. So a look at what's going on nationally. The United States is the country with the largest number of cases in the world. And when we look at individual cities or jurisdictions or areas, New York City remains the place with the highest number of cases in one area. In the last few weeks, our numbers have started to come down, and we can talk a little bit what that looks like on the other slide. But so far in New York City, we've had over 3,300 cases of monkeypox identified over the last few months. If you look to the left of the screen, you can see a map of the United States. The states or territories in a deeper, darker blue represents higher numbers of cases of MPV identified. And if you look at the map, you can see a lot of our major cities in the country. So the states, those deep blue states of California, Texas, Florida, Georgia, New York, even Illinois, for example, all have some of our largest cities. So we're definitely seeing spread in some of the larger cities, similar to what we're seeing in New York in terms of large, dense populated areas. So for New York City, I like to talk about where we have been, what we've been through, and where we are now. And so the image on the screen is a review of the daily cases that we identify in New York City over time. So if you look at what we see at the bottom, if you going from left to right over time, if you look at the up and down part of the graph, what you can see is the light blue represent daily case counts. So you can see when we were towards the middle where the blue line was at its highest, we were having over 90 cases a day across the city of folks being diagnosed with MPV. That solid blue line that looks a little squiggly, that's a summary, that's the average of cases. So you can see where we were around the beginning of August, where we had those really high cases. And if you follow it, you can see that the curve started to come down. That represents a decrease in cases over time. So we've definitely got through the worst part of the outbreak of MPV in New York City, and we want to stay in that place. And there's a lot of reasons why, and we'll talk to those. But I think we like to kind of talk about some of the symptoms, like what is this thing? How do we recognize it? So it's important to know that it can take up to 3 weeks for symptoms to develop after an exposure. We know that this thing it can take a little while after exposure. So that's one of the reasons why we're seeing the spread on folks demonstrate symptoms over that amount of time and that's how we know that it has spread so often, so much. The most common symptom is a rash or sore that can develop all over the body. Before we saw this current outbreak, we definitely saw, mostly in hands, mostly in the face, mostly on the trunk or the abdomen, what was described. But in the most recent outbreak, we've also seen it in other parts of the body. We've seen it in the mouth, we've seen it in folks' genitals, and other sensitive areas. These sores can be extremely painful, they can be extremely itchy, and you can develop new sores over a course of 2 to 4 weeks. So the length of the infection can go up to 4 weeks. There's some other symptoms that are not related to skin, which folks should be aware of. And I think one of the most common things are what we call a flu-like or a COVID-like illness in the early part of the infection, where folks have fever, chills, folks may have swollen or tender glands or lymph nodes. Folks also can develop headaches, kind of more like generalized symptoms of muscle aches, or fatigue or tiredness. Folks can have cough. So it can look like many different ways. When folks have some of those symptoms, the more general symptoms or flu-like, COVID-like symptoms, those usually can occur before or even when folks start to develop the rash or skin symptoms. So how does this disease spread? So it's a contagious, communicable, or something that can pass from person to person disease. We know that the primary way or the number one way that this thing spreads is through direct contact or direct touching someone who has a rash or someone with sores of someone who's infected. Often folks who are infected, usually really early before folks are able to recognize that they have the infection, is likely when this infection is transmitted. We also know that someone who is infected, that some of the virus can live on their clothing or their bedding or their towels. So touching certain objects or wearing certain objects or being in contact with certain objects is also possible to spread the disease, the virus. And then we also do know that prolonged close face-to-face contact can spread the virus. The virus can be found in some of the respiratory droplets, but what we do know is that the respiratory droplets are a lot less contagious than COVID or the flu, but this is primarily, again, a skin-to-skin infection. There's a few things that we don't know and that scientists are trying to find out and study, mostly about when folks are contagious. We know people are the most contagious or most likely are able to spread the virus from person to person when they do have symptoms, specifically the rash. But we're just trying to find out if it's possible for this thing to spread before the rash develops or how long after. But it seems like mostly folks are infectious until the rash is healed. It's also under investigation if spread of this virus through bodily fluids as well, just to find out how much and if bodily fluids are able to really transfer it or if it's more just the skin to skin. So who is at risk? I think one of the number one things that I like to lead with or start conversations out about risk is that anyone with skin is at risk for this thing potentially. It can affect any human or animal of any sexual orientation or gender identity. What we are seeing now, currently, the reported cases in the United States and other countries show that the virus is spreading in certain social groups, certain social networks. And it's mostly of mostly cis male identified folks who are either gay, bisexual, or any other man who has sex with men. But we also know that sexual networks are big and inclusive. And so we also know that folks who identify as trans are also part of these bigger networks, and also gender nonconforming and non-binary people as well. Currently, we think that the folks who are at the highest risk are those who may have multiple partners or anonymous partners. And we're seeing that most folks are coming in contact or being exposed to an MPV during sexual or intimate contact. So knowing that, there's guidance for how folks can protect sexual partners. And one of the most important things is to avoid sexual or intimate contact if feeling unwell, if you or a partner feels unwell, or if you have a rash or a sore or something that's new that you may not know yet, to really try to avoid contact until you diagnose or understand what is going on. For folks who are meeting partners and folks who continue to meet folks, we're recommending folks use latex condoms or latex as as a barrier method to hopefully prevent the transmission or the spread, possible spread through bodily fluids. Important to know that there's a lot of folks, over 3,000 folks who have had or been infected with MPV. And we're encouraging those folks to wear a condom or to use condoms for sex for about 8 weeks or 2 months after infection, as we try to understand if the virus remains in some of the bodily fluids. We're encouraging folks to not share towels, clothing, or other gear, even toothbrushes and other items, to reduce risk of exposure. And we're also encouraging folks to wash hands regularly and to wash bedding and any other accessories or toys after use. So with all of that said, what is the city doing? What's going on, and how are we trying to stop the spread? So this slide is a summary of a few things that are going on, but there's so much happening in the agency. We're working with a lot of our community partners, working with a lot of other city agencies to get the message out, to get folks vaccinated. So we're providing guidance to healthcare providers and assisting them with evaluating and diagnosing and treating MPV. New York City has been able to provide the highest number of prescription treatments for MPV cases in the nation. We've also have some of the highest vaccine numbers, which we'll share a little bit. Also, we're helping with testing specimens to help diagnose MPV. We're investigating, doing contact tracing, calling folks, getting the history, and contacting the folks who they may have been in contact with to kind of help stop the spread. The vaccine program, the city is helping to manage the vaccine program, one of the largest local health department programs in the country. We're working with outreach with community partners like yourselves. I'm talking to a lot of folks around the city about a lot of things to get information out and let folks know what options and what things are available to them. Media campaigns, advertisement, or going on digital platforms, doing a lot of advocacy with elected officials, engaging with folks in the press. So there's a lot of work going on in the city to raise awareness and to get folks vaccinated. I think just the level of awareness and the number of folks who are engaging is really really makes you proud to see the folk that we can get this message out and get this thing contained in such a short time. So now we'll talk about vaccines, because that's a big part of the conversation. It's not the whole thing, but it's a big part of the conversation. So we do have a vaccine that's available in the United States. It's called Jynneos. It was approved by the Food and Drug Administration for use in monkeypox as part of this emergency response. We've had this vaccine around for a few years because this vaccine was originally created for smallpox, which is a relative of monkeypox, and thankfully, the vaccine is also effective against monkeypox. So that's why we've had this vaccine out for a while. I guess the one bit of information that is important to know is that smallpox has been eradicated. It's really hard to find smallpox in the world, thankfully, because the vaccines were that good. And so a lot of the data, a lot of some of the other questions that folks have, we don't have some of that data, real world long-term data, just because the virus had been contained. But there's a lot of ongoing studies and trials to really understand. So we're going to get a lot more information about this and fill in some of those blanks. But the great thing is we do have a vaccine available. And even though the vaccine supply had been low, New York City had been receiving a sizable portion or a good amount of the vaccine because of our particular place as an epicenter in the country. The vaccinations in New York City, we vaccinated over 88,000 folks in New York City. Huge numbers right there. And it's all been due to a lot of our partners and a lot of some of the city run sites, but we also have a lot of folks who are vaccinating out in the community as well. We'll talk about the vaccine eligibility because that has changed a bit and has been an ongoing, rapidly evolving situation. But I think we're definitely getting to a much better place in terms of who can access the vaccine. So right now, the vaccine eligibility has been for a long time has been focused, because of the limited supply, has been focused on the communities and the networks that had been the most affected or burdened by this virus outbreak. So primarily men, both cis and trans, who identify as gay, bisexual, or other men who have sex with men, and or other folks of trans experience or background or identity. Also folks who are gender non-conforming or gender non-binary. The virus has primarily been in adults, people much older than people 18 and older, primarily 25 and older. We've also, eligibility is available or focused on folks who have multiple anonymous partners within the last 2 weeks. So folks who may have been who have the the highest risk for being exposed. Recently, eligibility has expanded to folks who are for sex workers or anyone who engages in survival sex or any other type of transactional sex of any sexual orientation or gender identity, knowing, occupational exposures or other kind of things that folks have to do to survive that may put folks at risk of exposure is something those folks need to be covered as well. There's also a few other different categories or folks who are eligible, mainly folks who are identified through contact tracing as a close contact. Important note that for folks who have been infected and recovered from monkeypox, we know that there is protection for the folks do develop a protection after an infection. So those folks are not currently eligible for vaccination. I do want to share, we got some word from we know that New York State is soon going to expand eligibility beyond even the current eligibility. And we saw that New York State should be expanding eligibility to a more PrEP kind of model for HIV PrEP eligibility. So very similar. So it's going to be folks who are most at risk for possible future exposure. So that should hopefully be going soon, and that should really open up the vaccine for a lot of other folks who have been who were excluded in the current eligibility criteria. So great news, expansion, more access coming. Wanted to share some other vaccine news for folks too, understanding that, folks may have seen in the headlines that the initial rollout, we have seen some inequities develop. So understanding that we really are focusing on access. So we've opened up a new vaccine location in the Bronx to increase access to a brick and mortar that's, to an actual building site where folks can come in for walk-in doses. The clinic is able to serve as many 100 people a day in the Bronx to get vaccinated through the walk-ins. And on Friday, we released an additional 16,000 vaccine doses, first and second doses online. Folks can walk in for first dose appointments at any of the New York City vaccine sites. You can find our vaccine sites on Vaccine Finder on our website. And then we're expanding the eligibility for second doses. So as of Friday, folks who were vaccinated, who got their first dose before July 23rd, are eligible to get second doses. Hopefully we can make the access for second doses be sooner and hopefully more available as well. So that's the goal. That's how we're getting there. And for folks who want updates on MPV, I encourage folks to text 692-692, text monkeypox to 692-692. And for folks who want text in Espanol, it's monkeypox ESP to 692-692. So now just shifting a little bit for the focus on folks who have it or may have it, what we can do to talk about some guidance, and then we can open up for questions. So for someone who may have monkeypox, who has symptoms that are concerning for monkeypox, the guidance is we recommend folks to, take a deep, and until you figure out what the next steps are, try to avoid sex or any intimate contact. If you have a symptom concerning for MPV, make sure in those first few days, the recommendation, be careful, try not to spread it to anyone, and act as if you do have it. So, making sure to wash your hands, especially if you touch any sore or anything that looks like that may be concerning for MPV. If you're around others in that time and you're unsure of your diagnosis, make sure to fully cover your rashes or sores, with wearing a long sleeve, wearing, a face mask at home is also important. Band-aids or other kind of bandages to cover up any sores that may be exposed is really helpful to prevent spread. And also just trying to minimize physical, much like during the time of COVID, trying to keep at least 6 feet of distance as much as possible. If you, especially if you live with someone and you're concerned for MPV, that's something that you can do to keep yourself, keep your housemates or folks who you may come in contact with safe. If you're using a shared bathroom or shared lunch facilities, making sure to clean before or after use. Don't share utensils. Just keep them separate. Wash before and after each use. Don't use same towels or beddings. You may have to share different beds. You may have to sleep on the couch, etc. And then avoid contact with pets. So one of the things that we know about MPV is that it originally started in animals, in small mammals. It was called monkeypox because it was originally found in some monkeys in a lab, but it's actually they find it more in small rodents, rats and other kind of things. So we know that it can spread from animals to humans. So we also want to make sure that we don't spread from humans to our furry friends. So try to avoid hugging and touching pets if you have lesions as well. All right, so what to do if you were diagnosed and you know that you have MPV and now you got to take care of yourself. So if you have MPV and you're diagnosed, if your symptoms are really severe, if they're really uncomfortable, you can talk to your provider about antiviral medication. Prescription meds are available in New York City. Free of charge, folks can be prescribed something called TPOC. Tecovirimat is the official name. TPOC is a treatment that has been available as well. It was available for treatment of smallpox, but it also is effective against MPV, monkeypox. So folks can start that treatment. Folks can also talk to the provider about if they need prescription meds for other kind of symptoms. Folks with severe mouth or throat symptoms may be prescribed medication. Folks may need more strong pain medications, or folks have symptoms in other uncomfortable places. Some folks are requiring prescription medications. Luckily, the majority of folks who are infected do not require prescription meds, do not have to be hospitalized. But I'm an internist, a primary care doc, and if folks are sick, folks having a fever, folks are ill, my number one advice is stay hydrated. When your body is sick, you need liquids. You lose a lot of liquids from sweating, with fevers, and just being ill. So staying hydrated is one of the best things to do, especially if folks have stomach issues. If you're vomiting or having diarrhea, staying hydrated is one of the most important things. One of the next things to really think about is primarily the number one symptoms are skin lesions, sores, rashes. So making sure that we keep the skin lesions, clean, keep them dry, covering them if we're out, but also, making sure that we let them heal, trying not to pick and scratch at them so you don't get scars is important. For folks who have fever, body aches, or any other things, over-the-counter, there's a lot of really important over-the-counter things that can help, such as ibuprofen, Aleve, or other kind of anti-inflammatory meds. For skin, for the itchiness, you can get Benadryl, you can take calamine lotion, just other kind of over-the-counter things which can help. Oatmeal baths are also really helpful. So there's a lot that can be done. And on the New York City Department of Health website, you can look at more information for things that you can do if you do have monkeypox and need help taking care of yourself at home. So as we get ready to wrap and open up for questions and comments, what can we all do? The important thing to know is that, currently right now, only one major community group or demographic group has been affected. The general population in New York City is not at high risk for exposure or contracting this thing. But what we can do is help support those who do have the highest risk of exposure and those who are infected, and sharing information, getting the information out there and raising awareness while also not raising alarm and stigma is really important. As all community advocates on this call, this is a really important thing that you can do. Educate yourself, get the right information so that you can help dispel myths and rumors. Signing up for updates is really helpful. Things change all the time. I get paid to go to the website and know all of these things, but I know a lot of folks don't. A lot of folks have other things to do, but checking out the websites, consistent, trusted messengers is important. Sharing information that from accurate messengers is important too. Destigmatize. We know that unfortunately in this country, people get really weird when you talk about LGBTQ folks, get really weird. If anything is related to sex, people just get really weird about things. So we want to destigmatize it, normalize the fact that, we're all in this together. We're all part of this bigger community. And it's unfortunate that we are all dealing with COVID and then this new thing comes on and it feels like a pylon. So whatever we can do to help alleviate some stress is really important. And then finally, it is, the stress that we're all dealing with, being aware of that, so folks may be going through a tough time. So just being aware of some of the mental health, behavioral health problems that folks may be coping with, connecting folks to a lot of the many services across the city. Just being a friend, calling and checking in on folks is helpful too. And if someone has it or if someone is concerned, just, help support and not, further stigmatize or make folks feel bad. There are all things that we can do to help keep ourselves and our community. There's a lot of other resources on the New York City Department of Health website. I encourage folks to just go look around. You can see a lot of the data, all the numbers that I shared, plus a lot more are available on the website. A lot of resources that can be printed out, posted in the house, posted in the common areas, all things that can be really helpful just to get folks information. On the screen, you can see one of the palm cards. There's a digital copies, and I think folks can also get a physical copy to hand out with just information, what folks can do, and help directing folks to additional information or if folks need help.
We're actively trying to get people vaccinated, get people aware of what's going on with MPV. And a couple things that you can do to help us is to share those social media posts. And also you're getting text messages from us as well. If you know someone who may qualify, I encourage you to contact us and we can get them an appointment. So somebody asked, can you have COVID and MPV at the same time? Sounds awful, but.
Yes, they're not mutually exclusive.
Yes. Do you foresee a time where the vaccination will be eligible to the general public? Is the hope just that it doesn't reach a point where that needs to be the case? What's the sort of outlook for that?
So I think that we're currently in a phase where New York City, where the containment of the acute or the big surge, we've gotten through that through vaccinations, through behavior changes, and kind of getting treatments out. So now I think where we're gonna move towards is this PrEP model, basically a pre-exposure prophylaxis. So the thought is certain folks who may come in contact. So these folks who may come in contact with folks within the community that's most affected. You guys kind of layer it a little bit. And so adding that layer is for folks who may not have recent exposures within the last couple of weeks, but may still be exposed just for that pre-exposure. So we're definitely going to be getting there pretty soon. And I think as more vaccine becomes available, I think it'll just be a part of the conversation for, hopefully routine, primary care, sexual health needs. Hopefully we'll get there soon.
If you do suspect that you might have MPV, what is the best way? Where should you go to find out?
Yeah, so recommending folks to get it checked out with their medical provider. If you have a primary medical provider, call them, let them know, this is your concern. The reality is a lot of times, if you don't have the medical training, you may not be able to look at this thing and be like, oh, that's MPV. A lot of what happens, it can look like, the first thing can look like a pimple, can look like something, and so it may be a few days before you're like, oh, this feels a little different.
This is something more.
Yes.
Yeah.
So just seek a medical provider. If you don't have a medical provider, just to, talk about it through and have an evaluation and a test. You can call 311. And there's also, you can find someone through the New York City Health Map on our website too. But 311 would probably be the next step. You can find someone using like a health in hospitals, or, in the public hospital.
How long do MPV symptoms usually last?
So the symptoms usually can last from up to 2 to 4 weeks. We've seen some folks develop, the skin lesions, they'll come, they'll heal, and then new ones will come, and that can last up to about 4 weeks. We've seen some folks have, we've seen a range. So we've seen some folks have very mild symptoms, very few lesions. Some folks have a lot in very uncomfortable places. So it can be a range, but it can last up to 4 weeks.
Do people have MPV without the lesions or rash? So can you have like flu-like symptoms and like itching or something like that, but not the visible lesions or rash?
This is it's a systemic illness. So your body, you're infected with MPV, and usually what happens, those symptoms, the fever, the chills, some of that's your body's initial immune response. So when we talk about COVID and we talk about the vaccines, sometimes your body's immune response is picking up. You can feel some of that, but when you're infected, same thing. So yeah, some folks in those early days when their immune system is activating, they can have fever and chills and the swollen lymph nodes before they actually develop the rash and the skin findings and the itchiness. So yeah, there is a period where some folks can have that first. And we're hearing from some of the case investigations, folks, they feel that, and then they do the next thing. You get your rapid COVID test, and you do it a couple of times, it's negative. And we're like, oh, maybe it's a cold. And then, folks will see the rash and the things start to develop. But yes.
Yeah, that's an interesting thing about sort of protocol for that too, because I think it's good, especially in those phases where that might be a symptom that looks like COVID, is to like rule that out and then sort of go from there.
Rule out the things that you should rule out,
Yeah.
Just if you have those symptoms in this, in this economy, it's like, make sure it's not COVID, make sure it's not flu, if I have certain exposures or things that make me concerned for MPV, keep that on the idea too. But the biggest thing is if you develop those symptoms, whatever those symptoms are, think about how can I minimize exposure to other folks and, and figure out what's going on. That's like the number one thing.
Do we have any sort of sense of whether the lesions leave scars at this point?
Yeah, so we know that they can, especially, if there's a big inflammatory reaction, usually from like a local kind of, the biggest thing is the itching. So folks are itching and scratching an open wound and sore, it can cause some scarring, discoloration, or change in color. Some folks get darker pigmentation, some folks get lighter pigmentation, some folks can kind of have, a thing that kind of lingers. And so because of that, one of the things that we want to address for that, particularly folks who have higher melanin or darker darker skin tones. It can be a big issue with scarring. So the health department actually, we're organizing a webinar before the end of the month that we can share out with partners. Feel free to share with the community, with the Skin of Color Society, a national dermatology group, to kind of have some experts just come and bring them into the part of the conversation to highlight some of those other concerns from the infection itself, and then just to talk about, the vaccines and some of the concerns that folks have as well. Technically, there are 2 vaccines that are out there that can be used for MPV. The United States is just using one vaccine, that's the Jynneos. It's newer, has a more favorable less side effects than the older one. In MPV, it's a 2-dose regimen. It takes 2 shots to get a full vaccination. Usually they can be divided by 4 weeks, but you can spread out that second dose a little bit longer, which we've had to because of the supply issues. But yeah, 2 doses for full vaccination.
And one of the things that we've encountered in doing our outreach is people who have gotten their first vaccine, and sort of the protocol with the city seems to be like they get contacted after 10 weeks at this point because of the availability of dosages. So if you know someone who's gotten one, you can tell them, what's happening right now is that they'll be contacted at 10 weeks. Am I correct about that? Yeah. I just want to make sure I'm saying the right
Folks
thing.
are getting contacted, but we're even trying to, help to expand the access so we can get folks in sooner. So yes, folks should expect to, but if you don't get someone call you by week 8 after vaccines, or around 2 months after you've gotten the vaccine, definitely check in, because by week 8, folks may soon be able to get that second dose.
Do you have advice for how to deal with the stigma when you encounter it? So one of the things that we found in doing outreach is that, there are some people that don't want to talk to you because I think that they're assuming that, you're assuming that they're gay in order to have that conversation with them, that people sort of, like you said, people get weird around LGBT stuff, people get weird around sex stuff. Like, what's your advice about how to sort of lessen that stigma a little bit when having those conversations?
Yeah, so that's a great question. So, generally, my approach and what I recommend, coming from a sexual health background, normalizing the question, right? So normalizing the engagement, so, hey, my name is so-and-so, I work with such and such group, and just right there, have you heard about this? We're talking to everyone, and just talking to everyone about this new thing that's in the community. We want to raise knowledge, get information out to folks. What have you heard? Asking it in that way versus you would have
are you at risk?
So it's just, and not even focusing on the risk stuff and what you shouldn't do, but like what you can do, so it's like, we just want to get awareness out. And if someone wants to ask more, you can go there, but sometimes it's just, you can go to this website to read more about it. We just we want to educate the community, want to, raise awareness. That's a good angle. And then if just being open, if someone wants to ask more, to kind of do that.
So that is our appointment scheduling card. Please, if you know anyone, this is up on our social media as well. If you know anyone who may need access to an appointment, one of the great things that is happening with us in partnership with the Department of Health is that we have access to a block of appointments that are available to us that we can schedule someone who's eligible for the vaccine into those appointments directly. So that's really helpful, because I know people have had issues with vaccine availability because the appointments get filled up really fast because there's high demand. So please, if you know anyone who qualifies based on what we've talked about today, please have them contact us at one of these numbers. We have an English line and a Spanish line. They can also email us. They can either text or call those 2 numbers, and we will very gladly help them make an appointment.